Well, my name is Daniel Antonio García Viañan. I'm a dentist student at the University of Sinú, Elías Betiara Sinú in Cartagena, Colombia. And today I will talk about the scaling and root planing technique in the periodontist class. Well, the scaling and root planing is a dental treatment that is done to remove food debris and calcified dirt. The name is dental calculus, and basically we can use two types of curettes. The universal or Columbia's curettes, and they have two cutting edges, and the specific or García curettes that have just a single cutting edge and are used in specific areas of the oral cavity for the anterior or posterior teeth and upper teeth and lower teeth too. In this case, we have just 3 curettes: the 7-8 curette, the 11-12 curette, and 13-14 curette. The initial movement are made in the apical coronal direction, this. But also we have other movement that is horizontal movement in the distal to mesial movement, and we have other movement that is in the oblique direction. Well, the step-by-step about the scaling and root planing technique is this. The step number 1 is the correct way to take the curette. Is in the modified pen, because in this way we have 3 points of support: thumb, index finger, and middle finger, and we take the curette in this way. This we do to avoid a twist of the curette when we apply pressure in the tooth. The step number 2, we take a digital support point, intraoral or extraoral. Intraoral on the tooth close to the workplace. For example, if we work in this teeth, the intraoral support point is this or this, near to the workplace, and extraoral can be on the patient's face but not on the lips, facilitating movement and also firmness. The step number 3, the correct active part of the curette is selected. In this case, the correct part to work in this teeth is this. And the step number 4, we place the active teeth gently on the tooth. The step number 5 is the active tip is gently inserted into the junctional epithelium in this way. The step number 6, we establish a working angulation of more than 45 degrees and less than 90 degrees in this direction. More than 45 and less than 90. And the 7 step about the technique is we apply a slight lateral pressure to the tooth surface. Step number 8 is then some exploratory movements are made until finding tartar or irregularities. In this movement, not so much pressure is applying. They are recognized where there is presence of tartar or calculus. We recognize where is presence of tartar or calculus. Step number 9. If calculus is found, root scattering movements are made. These are movements in series, short and strong until all the dental calculus has been removed. In this way. And finally, step number 10, root planing movements are made on the root surface. These are serious movements with slight pressures but long movements until the root surface is smooth and uniform.